welcome to Session 1 of the Health Center Association of Nebraska On-Demand Health Center Board Series. Before we get started, I'd like to introduce you to our expert consultant, Mr. Burt Waller. Mr. Waller has devoted 40 years to leading healthcare organizations ranging from large hospitals to small startup community health centers. After a 25-year career leading large urban health systems in Texas and Tennessee, he redirected his work toward expanding access to basic primary care services for marginalized populations. Mr. Waller works as an independent contractor assisting HRSA with operational site visits and other technical assistance needs. Burt has a keen understanding of health policy and finance, the role and responsibility of health center boards, and the relationship between health centers and large health systems. His insights about delivery of health care for the underserved has been reported on NPR and in numerous publications, including the Wall Street Journal and Health Affairs. He is a Life Fellow of the American College of Healthcare Executives. I'm going to hand it over to Mr. Waller now to walk us through the learning objectives for Session 1 on the Health Center Governing Board and meeting HRSA's continuous compliance expectation. Take it away, Burt.
Thank you, Jenna. We really appreciate your interest in this training offered by the Health Center Association of Nebraska. This is the first of 6 brief sessions designed to engage boards of directors of community health centers and provide support for compliance with the regulations and expectations of the Health Resources and Services Administration, HRSA, and its Bureau of Primary Health Care. Our training objectives are focused on helping you perform well during your operational site visit, the OSV. During these sessions, we'll specifically review the compliance elements that prove most troublesome. That will be much of the focus of sessions 2, 3, 4, and 5. All through the sessions, we'll use examples of best practices in hopes it will support you in your efforts to have a high-performing board. In my work with health center boards, I found it useful to provide a brief overview of HRSA's perspective about health centers. HRSA's view is that it's the role of the board to be knowledgeable about HRSA's expectations. One of the overarching goals is for primary care services to be comprehensive, culturally competent, and of high quality. HRSA wants to ensure health centers are sensitive to the various barriers to access that the patients encounter, sometimes economic, sometimes geographic, sometimes cultural, and often a complex mix of all these factors. It's always helpful for the board to keep in mind during its decision-making, how does this particular decision either expand access or reduce barriers for this vulnerable population. And HRSA is further concerned about certain most vulnerable populations. This might include the homeless, agricultural workers, many of whom are migrants, residents of public housing, and veterans. At a foundational or fundamental level, HRSA expects you as the board of the health center to be accountable that the organization is providing culturally and clinically competent, comprehensive primary care, that you're working with others when necessary to provide needed supportive services, and that you're ensuring that financial barriers to care are minimized or removed through the adoption of a sliding fee scale and a nominal fee for low-income uninsured patients. HRSA is very clear in its expectations that the board be patient-centric, and the required patient majority is the primary manifestation of that expectation. And especially in this era of rapid structural change in healthcare delivery system, HRSA expects that while working closely with other healthcare organizations, you will maintain your autonomy. These are points that we'll review in more detail in upcoming sessions. Because health centers serve diverse medically underserved neighborhoods, communities, and people groups, You as the board are expected to know much about your service area and the people who populate it. Your documentation of your board proceedings must show how you are using this knowledge in the decisions you make. And finally, HRSA has some very specific expectations about the board's responsibilities for its oversight of administrative, clinical, and financial functions. Again, we will review those more fully in upcoming sessions. The work of community health centers was established by Section 330 of the Public Health Services Act, and that was created in 1996 as an amendment to the earlier Public Health Services Act. In 2017, HRSA published a significant update of its expectations, the Health Center Compliance Manual, and in it has consolidated virtually all of its expectations about health centers, their role, their responsibilities, and the work of the governing board. With the compliance manual, HRSA also issued the site visit protocol that makes available to all of us the specific questions to be answered during the operational site visit. These two publications are the essential materials that you as the board and your administration should be using in preparing for the actual operational site visit. The OSV is an on-site, or in these times, sometimes virtual, review conducted by consultants with expertise in clinical services, finance, and health center governance and administration. The tools, those site visit protocol and the compliance manual, are designed to support your capacity to know what is expected, to conduct a self-assessment, and to ensure ongoing and continuous compliance. The purpose of this HRSA-provided slide is to share the concept of continuous compliance and make clear that every health center will have an operational site visit midway during its project period, even if it's a one-year project period. One final resource HRSA makes available is the Health Resources Clearinghouse. This is an online resource. It includes a multitude of materials, and it's a good general resource for you to access on a wide variety of topics, including those related to the governance of health centers. In our next sessions, we will look at essential documentation, the specifics of board authority, and of board composition. And then in our final brief session, we'll talk about what's necessary to prepare the board for an operational site visit. Now, I'll hand it back over to Jenna for a wrap-up of this first session.
Thank you so much, Burt. If you need additional information, Burt and my contact information is listed on this slide. You can reach either of us via email. So I'd like to thank everyone so much for your time, and we hope you join us for the next session on essential OSV documentation for health center boards.